One of the best things about being Canadian is free healthcare, right? No matter how sick you are, you'll always get the care you need exactly when you need it. Well, I'm here to tell you that if you get really sick, you might be in for a big surprise. In 2017, Senator Bernie Sanders, a huge supporter of Canadian healthcare, came to Canada to learn about our system. He toured the biggest, shiniest hospitals in downtown Toronto. He thought Canadian healthcare was just great and that it would be a fantastic thing for the USA. Here are 5 things I wish the Senator had learned on his visit. First, wealthy Canadians get more care and wait less than poor Canadians. Politicians keep saying that everyone gets care regardless of ability to pay. It is not true. We have known it is not true for almost 2 decades. Despite our single-payer system and the fact that people do not pay to receive care, patients with a higher socioeconomic status get more care and wait less to get it. A New England Journal article showed that patients living in the wealthiest neighborhoods had 23% more heart procedures and a 45% shorter wait time than patients living in the poorest neighborhoods in Ontario. Other studies say the same thing. Canada has lost the moral high ground, and we cannot claim that our system treats all people equally. Second, wait times are long and painful in Canada. Study after study shows that Canada often ranks dead last in wait times and close to last for care overall compared with other OECD countries. Our hospital hallways overflow with patients waiting for beds. We even call it hallway medicine. Third, Canadian healthcare is expensive. Contrary to what ministers of health often say, healthcare is not free. We spend more and get less than places like Germany, England, France, even Malta and Oman. Canada spends $242 billion on healthcare each year, over $6,600 per person, with some families contributing up to $40,000 per year through taxation, and those costs are going up fast. In 2010, economist Don Drummond said that at the rate we're going, healthcare would consume 80% of provincial budgets by 2030. This would leave only 20% of these budgets for education, roads, police, the provincial courts. That's pretty scary. The fourth thing I'd want the Senator to know is that government sanctioned an exclusive private healthcare tier to fast-track a select group of patients. When a worker gets injured on the job, the government pays their disability claims through workers' compensation. This costs a ton of money. The government knows that getting workers back to work saves the government money. So instead of paying disability claims, government lets injured workers jump to the front of the line in a special private care organization only open to injured workers. Here's how it works. You injure your knee playing soccer, you could wait up to 10 months to see an orthopedic surgeon. If your neighbor injures his knee at work, he waits only 10 days. In Ontario, all knees are equal, but some are more equal than others. Finally, given all of this, many patients just leave Canada for care. Over 63,000 patients left Canada for care outside the country in 2017. But more concerning, though, is that former Prime Minister Jean Chrétien, Premiers Danny Williams and Robert Bourassa, and MP Belinda Stronach, and many other politicians have also left Canada for personal care. If the people with the power to change our system leave Canada when they get sick, what does that say for the rest of us? Canadian healthcare was once great. In the 1970s, we had more hospital beds than other countries, and we had too few sick people to fill them. Today, we have almost as many bureaucrats in healthcare as we have beds in hospitals. Canadians love our healthcare system, but that's because most of us rarely use it for anything major. Only 3 to 4% of us ever need major care in any given year, and 80% of the dollars spent on our personal care will occur in the last 4 years of our life. It's easy to love the idea of Medicare if we've never needed it and don't know all the facts. It's time for us to take a closer look. I'm Dr. Sean Watley, author of No More Lethal Weights.